Hello, my name is Laguerre, and I will be discussing the drug Lisinopril. I will present the relevant background information before I explain the mechanism of action and key features of this particular drug. Additionally, I will discuss the adverse effects, notable examples, and the type of treatment Lisinopril is used for in the medical field today. Lisinopril was originally patented in 1978. However, it was not approved for medical use in the United States until a decade later. It is classified as an angiotensin-converting enzyme inhibitor. Currently, lisinopril is used for a variety of treatments, one of the most common being high blood pressure management. Research has shown that it can also improve survival chances following a heart attack. The specific mechanism of action for lisinopril involves the alpha-globulin angiotensinogen. Angiotensinogen is secreted from the liver, and it is part of the renin-angiotensin-aldosterone hormone system that regulates blood pressure and fluid balance. ACE inhibitors like lisinopril work by blocking the angiotensin-converting enzyme secreted by the lungs, which normally converts angiotensin 1 into angiotensin 2. Angiotensin 2 can bind to blood vessels and cause vasoconstriction, as well as release of the hormone aldosterone, which works to increase blood pressure further. ACE inhibitors prevent these actions from angiotensin 2 and increase the vasodilator and mild diuretic bradykinin. Essentially, the specific chemicals responsible for tightening blood vessels are decreased, allowing blood to flow more smoothly and the heart to pump blood more effectively, thereby decreasing blood pressure. Unlike other well-known ACE inhibitors like enalapril and captopril, lisinopril has a long half-life, is hydrophilic, and it's not metabolized by the liver, so it will be excreted as an unchanged compound. Aside from captopril, lisinopril is the only other ACE inhibitor that is not a prodrug, a compound with very little pharmacological activity that can metabolize in the body and convert it into a pharmacologically active drug compound. As you can see, lisinopril is contraindicated in the case of angioedema, pregnancy or nursing, kidney problems, or liver disease. However, it is advisable for patients with high blood pressure, diabetic kidney disease, heart failure, or suffering from a recent heart attack. There are a number of adverse side effects associated with lisinopril, including dry cough, hypotension, dizziness, headache, renal insufficiency, blurred vision, itchy or mild skin rash, and hypokalemia, meaning there's a high amount of potassium in the blood. This is more common among patients with reduced kidney function. One of the most notable consequences of lisinopril is angioedema. This condition is characterized by a swelling of the deeper layers of the skin, subcutaneous and submucosal tissues. It can occur in the head, face, extremities, and intestine. ACE inhibitors such as lisinopril are considered one of the leading causes of drug-induced angioedema in the United States. Essentially, lisinopril can increase bradykinin, which can lead to an increase in vasodilation and vascular permeability of the postcapillary venules, which allows for plasma extravasation into the submucosal tissue. In one case, a 66-year-old patient visited the emergency room complaining of swelling at the back of his throat and difficulty breathing. This was determined to be caused by an allergic reaction to lisinopril. Despite various treatments, the patient's condition progressed to complete airway obstruction. The patient entered cardiopulmonary arrest during the tracheotomy, resulting in encephalopathy and eventually death. Lisinopril has been approved by the U.S. Food and Drug Administration to treat the following conditions. However, previous studies have suggested the potential use for diabetic neuropathy, post-transplant erythrocytosis, and proteinuria, a condition in which there is a high level of protein present in the urine, indicating kidney damage. In patients of African origins, research has demonstrated that this type of medication is less effective for hypertension specifically. Calcium channel blockers or thiazide-like diuretics are known to be more effective in this case. In closing, lisinopril has been available for several decades, and it is considered one of the most widely used treatments for heart failure, heart attack, and hypertension. However, as with any drug, it is important to consider the contraindications, potential adverse reactions, and drug interactions. This is necessary to reduce the possibility of potential adverse effects, as in the case of the 66-year-old patient. After all, the aim of medicine is to prevent disease and prolong life. The ideal of medicine is to eliminate the need of a physician. Thank you for your time.